WION is the only channel which has been leading with its coverage on coronavirus. And to begin with, our focus is India's 15 Italian tourists who were quarantined in the ITBP Chavla camp have been tested positive for coronavirus in the first testing. Now, samples have been sent to the Pune Institute for confirmation. Confirmed cases in India may rise to 21 if they test positive. Italian national's wife in the SMS hospital of Jaipur has also been tested positive in her first test. A confirmation too is awaited from Pune NIV. And for more details from Ground Zero, let's quickly go across to our principal diplomatic correspondent Siddhant Sibbal, who's been reporting extensively on this news story. Siddhant, now, even though a final confirmation on the Italian tourists is awaited, what's the total number of confirmed cases that we are possibly looking at? And should we expect any communication from the Union Health Minister anytime soon?
Well, yes, the Indian Health Minister will be doing a press conference at 12 noon Indian Standard Time. Right now, he is doing a briefing, and after that, he will be doing a press briefing as well. But talking about the number of confirmed cases, 6 people have been confirmed having the virus here in India, out of which 3 in the southern Indian state of Kerala have been discharged. But we know that 3 cases came to light in last just 3 days. 1 from Delhi, 1 from Telangana, and 1 from Rajasthan. The tourist from Rajasthan is an Italian tourist and was part of a larger group of Italian tourists who were on an India visit. They were in Jaipur, and once it was confirmed that the person who was confirmed with the virus was in contact with these tourists, they were taken to ITBP's quarantine camp here in the national capital, Delhi. The Chavla camp, they are present there in the Chavla camp, and samples, the first set of samples were sent, and it confirmed that 15 of the tourists which were taken at the Chavla camp have the virus. But now the sample has been again sent to Pune for further confirmation, and we do expect an official release to confirm this development. But as of now, sources are confirming that these 15 Italian tourists in the first testing confirmed that they had the virus. So we know that the Indian authorities are taking a lot of measures when it comes to making sure that the virus does not spread, including from the Delhi confirmed case. We know that the Delhi confirmed case came from Italy. The person came from Italy via Vienna, and this person was a case of self-declaration. He was in the city, was part of a get-together as well from the time he landed here in Delhi till the time he was admitted in the hospital.
Right. You know, containing this outbreak is actually very, very crucial this moment. How critical is the ITBP camp at Chavla this moment, considering it's housing most of the evacuees and the possibly infected patients?
Well, there are 2 camps in India. One is the Manesar camp in Haryana state, which is being run by the Indian Army, and another by the ITBP, which is in Chavla, which is in Delhi. And we know that it is also hosting the people evacuated from Wuhan. All measures are being taken. They have been put in isolation. We also know that the screening have been taking place across all major international airports. Approximately 21 airports across this country, the screening have been taking place. And of course, India has taken other measures as well, including no visas for people coming from China, Japan, Iran, countries which have been worst impacted by this virus. But right now, what is on the top of the mind of the government here is to make sure that it does not spread, and also there is no panic when it comes to the public. We know that yesterday the DGFT had taken a measure by which the ingredients which are used to make the medicine for to cure this entire virus have been stopped for export to other countries. We also know that India is taking measures like when it comes to the fact that the hospitals are ready for further isolation. There are 25 hospitals here in Delhi which have been earmarked where there are isolation wards. So these are the measures which are being taken by the government here, but so far it is bad news. Globally, we know it is spreading very fast, whether it's China, whether it's Iran, or whether it's Italy. We know that Iran and Italy are the worst impacted by this virus after China.
Absolutely, and many are already questioning how well equipped is the Indian government at the moment. But Siddhant, more importantly, Delhi is already reporting a shortage of masks and hand sanitizers. How is the government planning to address the crisis in terms of supplies? Not to forget, educating the masses about the need to self-declare and practice quarantine.
Well, as of now, we know that the government is putting out with releases. It has been assuring yesterday, a day before yesterday, there was a briefing by the Indian Health Minister. He assured the public that they need not to worry about. And also when it comes to medicines, also they said that they have supplies for next 2 to 3 months. But the fact that the panic could spread very fast, we do expect the government to come out with more developments or more actions or more releases, telling them that they do not need to worry. The public do not need to worry. We also know that the Delhi Health Minister did a briefing yesterday. He told that the number of masks present in the city and also the equipments needed by the people who will be testing the people who might be having this virus. But largely we know that the Indian government started taking measures immediately after China reported its first case in January. We also know a group of ministers have been constituted here in India, which includes India's Health Minister, India's External Affairs Minister, people from the Army, ITBP and other stakeholders, and they have been meeting regularly. They of course have been meeting once a week, but it seems that from this week they are going to meet every day so as to make sure that they get constant updates and developments, and they can tell the public also what are the measures they are taking.
Absolutely, and let's hope this actually leads to better precautions coming in from the government. Thank you so much, Siddhant Sibal, for bringing us all the latest on coronavirus.